We commemorate, we celebrate. The specialist will tell us what is the best term to use in this occurrence is International World Epilepsy Day, especially done on the second Monday of every February. And so we'll be learning some bits of what this is all about and what are some of the things that need to be done if you are to get the diagnosis, at what point you need to seek medical advice, at what point do you address some of these challenges that come along with that. We understand the difference between epilepsy and seizure, or so to speak, and so much. So that's why we always dedicate our Mondays for Matters Health, and good enough, this has landed at exactly a Monday. So we'll be having this conversation alongside, that is Joanne, will be joining Joanne Kagema. Yes, Joanne Kagema is a nurse at the Kenyatta National Hospital. Will be joining us via Skype to have this conversation. And with me in studio is Frederick Beuchi, who's epilepsy awareness activist. And it's good to have you this morning, gentlemen. And Joanne also, who's already on Skype. Good morning. Joanne, can you hear me? Good morning.
Yeah,
good to have you. Good to have you this morning.
Nice to have you this morning. And I'm glad to talk about it. And thank you for calling us.
Thank you so much, Frederick. Good to have you. Yes. Good to have you.
Thank you too.
And so, of course, the conversation is the straightest forward.
Yeah.
I always say on Matters Health, I'm not a specialist, but again, you realize that health is of interest to everybody.
Yeah, sure.
Because if you're not sick today, tomorrow you are. The next day you close, a relative is, or a close person to you is. And so sometimes to gather some of this basic knowledge is really, really important. Some people are suffering in silence, and especially in matters like this, on matters epilepsy, sometimes people look at this as though it's something that is not so good to look at, the stigma that revolves around this. And I think we need to have conversations that will take us from that point to a different conversation altogether, where we're all going to appreciate the state that we are in and seek to find remedies to some of the problems that we face and some of the sicknesses that, or the conditions that we are suffering from. And so just what is all about the Epilepsy Awareness Day?
International Epilepsy Day is commemorated every year.
Yes.
It's the second Monday of February. And this was arrived at by contributions from the International League Against Epilepsy and International Bureau for Epilepsy, coming together and to just synergize organizations in celebrating and marking this day. And that was arrived at because epilepsy is a condition that has been known for quite some time, although it has not been given that much attention as it really needs. And I think it's all other conditions that are related to, the damage of the brain. People are not so keen in trying to find out how these conditions come to be, because they are related to so many other things. I always say, if you ask somebody if you have a headache, what do you do? Or if you have a stomachache, they'll tell you, I'll go to the chemist and I'll ask for medication. But anything to do with the brain, before we get to the point of medication, so many other things would have been done to this person. So it leaves a lot to be desired when it comes to knowledge, information, and education to people. Surprisingly, even for those that are learned, you ask them about such conditions and they're like, epilepsy, really not a medical condition.
Okay.
We know what causes it, we know from the background of our cultures what it is. So yeah, it leaves a lot to be desired, and that's why this day was set, so that information can be spread and for people to know that it's a medical condition.
Joanne, is there data on just how far this condition is witnessed in the country? Because people will tell you maybe they barely focus on getting basic information about it because it's not as common.
The data for the Kenyan is not yet available. There's no much studies that have been done in this country. But epilepsy is rampant because in what we call like disability, or what we call that people living with disability, because even epilepsy can be one of condition that can be said that it causes a lot of disability because it brings incognition in the mind. It also brings a behavior challenge. So it has a 0.3 innate of the population, 0.3% of the population.
All right, well, at point 3, now let's get to the basics of it. At least with my little knowledge, I know there's that conversation of epilepsy, and you do find that at some point in time you speak about seizure. I find it so hard to pronounce that. Yes, it's indeed a mouthful. So, what is epilepsy and what is seizure?
Well, in simple terms, I would say epilepsy is a condition that is caused by brain damage.
Okay.
And your brain can be damaged in either getting an injury of the head, and then the injury goes deeper, it touches the brain. Personally, to advocate for epilepsy is because I have a sister who was diagnosed with epilepsy at the age of 2.
Okay.
And her brain got damaged from getting infections, which was cerebral malaria. Others get the same brain damage out of either a condition or infections like meningitis. There is a lot that happens also in the delivery room, and sometimes mothers who experience birth complications also might end up getting a child's brain damaged, and so later develop epilepsy. And we are not saying all brain damages end up developing epilepsy. We have so many other conditions that are attached to brain damage that are not necessarily
so this happens in early stages, or generally even in life at such a time as old as I am, I'd probably get brain damage, and it ends up to...
It's key to note that anyone can get epilepsy from any age, any race, any gender. We are all at risk of getting epilepsy at one point of our lifetime, because we use transport, and that's why even for the boda guys, we are telling people, when you board that motorcycle, is this guy keen enough to give you a helmet? The things that we expose ourselves to are putting us at a danger of getting injuries, which at the end of the day might actually cause some brain damage and develop epilepsy. So back to your question of epilepsy and seizures. Epilepsy manifests itself through seizures. So seizure is, I would call that as symptoms, or how do you get to know that somebody has epilepsy? And it is in different forms. I think Joanne can also share on that, but we have over 40 types of seizure types, but they are grouped into 3. You have partial, you have absence, and you have the generalized seizures. So generalized, you ask anyone about epilepsy, they'll tell you is that condition where somebody falls down and they jerk. That's the generalized one. It's the most common one that people know. Absence, not very common, but in children also it's found to be very rampant. You are talking to a child, and then for a second they go off. You think they are listening to you, only for them to come back again and ask, what were you saying? So in an environment of a classroom, or even at home, the mother or even the teacher might think this child is rude, and we always spread awareness to them also, to just make them understand the things that they need to look keenly, because that's already a red flag for a child who might end up developing epilepsy.
All right, so then Joanne, come in and tell us what then is the connection between these two, and that is epilepsy and seizure. Now that you say it. What is the connection between the two, and what is actually the main difference between the two?
When we talk about epilepsy, it's what we call it's abnormal excessive electrical. It's an abnormal electrical activity arising from the brain. That is what we call epilepsy. It's an abnormal activity in the brain that goes like an electrical current.
Okay.
So it is usually an abnormal motor activity, and also it affects also the abnormal behavior, and also disordered mental or emotional activity. That is what we call epilepsy, and that is how we define it. So in most of the cases, we usually say it is characterized by repeated seizures due to disorder of the brain cells. So a seizure is that activity that happens in the brain. Do you understand? So epilepsy is a condition.
How long would it last?
It depends on how it is started, because there are some which can run for 2 minutes, seconds, even a minute. And those that have continuous, we call status epilepticus, which are continuous conversions continuously. That can last even an hour. And that one is a medical emergency.
All right. So one would then want to know if they have seizure, does it then mean they have epilepsy? If it is not the case, based on what it is that Frederick spoke about, to what percentage would one, say that if I have seizure, then this is likely to culminate to someone being epileptic?
There are very different types of seizures, as my brother has said, and
Yes.
Frederick has said.
Yes.
Because even febrile seizures, where you find that children are getting fevers, and they end up having a conversion. You understand?
Mm-hmm.
They get to have a conversion. And most of the time, if it's continuous, you have to give them an anticonvulsant to stop it. But always ensure that the child is not feverish. You always need to monitor the temperatures, keep the child by either giving the calpol and also sponging the child, so that it doesn't, the temperatures doesn't rise. So those are some of the seizures that can be brought. And also in status epilepticus, as I had earlier said. And also, there are times that we can have also drug-resistant epilepsy, which brings out more of the convulsions, more of the seizures. So those are some of the things that can be brought. While my Frederick had talked about the causes of the epilepsy, he had talked about head injury, he had talked about birth defects, defects and just long labor. When a mother is delivering, either you have an obstructive labor, whether you have prolonged labor, and some other diseases that a mother can encounter when is pregnant. And also head injuries, either as childhood, whether an accident in an adult, etc., etc. Mm-hmm. And also some other diseases like meningitis. You can get epilepsy as a complication of meningitis. So there are some diseases that you can get you a complication of the epilepsy.
All right. Well, in this case, then one would want to understand how is it diagnosed, and in the event that you have been diagnosed to be epileptic, is there a way that the same can be reversed there, or it becomes a condition that you have to stay with for the rest of time?
Well, I guess that's a question of whether epilepsy is treatable or it's curable, and so many people really ask the same. Epilepsy is a condition that is manageable. I would put it so, because once one is diagnosed the type of epilepsy that they have, then they can be able to be given medication that will help to reduce either the frequency of seizure.
Did you speak about the types that are in existence? I think we only mentioned the types that are there for seizures.
I mean, the types, of epilepsy types are over 40. Okay. But to just give the viewer a picture, is they are grouped into 3. And the ones that I've mentioned, partial seizure, absence, and the generalized seizures. Yes. Okay. So all these types are types that are manageable with medication. anti-epileptic drugs. There are variety. So the good thing to advise somebody is once they have either noticed a seizure, any type of seizure, then it's good to go for the proper diagnosis in a hospital so that they are put under medication immediately, possibly, so that they are able then to control the seizure. Because the only challenge here with epilepsy is it's the seizures that make somebody not be able to live their normal life. And for that matter, then you find out that epilepsy is not only grouped as a non-communicable disease, but is also identified also as a disability, because seizures tend to make somebody not be able to live their normal life with the capacity that they have.
All right, let's talk managing this and a little bit deep in terms of how, as an individual, one can be able to manage this, and also how then the help of family members, the help of the people you stay around can come in handy towards that. Joanne?
One thing that we need to do is to demystify epilepsy, because it comes with a lot of myths and a lot of stigma. The reason why, because once we are told that you have epilepsy, many things start happening, people start thinking, and also it even affects all of us, including the family, including even the country itself, because once you get it as, for instance, when you get it as an adult, you have to ask yourself many questions, whether you live a normal life, how will you behaving, how may you get if I get a seizure on the way, what happens? Those are some of the things. The important thing is to maintain, to have adherence. What I mean is that you need, as you are seen by the doctors, as you have been prescribed the medication, you need to have your medication throughout as prescribed. Also, we advocate that every person who has epilepsy should have a ribbon or a tag, or what we call a ribbon, so that whenever you can get a problem, somebody will be able to identify and also to rush to the nearest hospital, and to be easy to even prove.
This will not escalate the levels of stigma. I mean, if you go around labeled, or when you say label, what exactly do you mean? Carry something inside your wallet, say?
No, for the labels, for the ribbons and the ribbons is in case you get a seizure or a conversion on the way, or somewhere that you are not, there's somewhere that there is no much help and you can be assisted to go to the. But for the stigma, we need to create awareness to the community, to the churches, and to every small groups, and even to the government. We need to shout and say that epilepsy is there and it's affecting. It does not matter whether it's genetic, because when you classify epilepsy, you classify it in two. It can be a genetic and it can be idiopathic. Idiopathic is what I mean, that it has no known cause. So you can get epilepsy without any cause. It can be, you just got epilepsy. You may not have had head injury, you may not have had any bad defects, you may not have had any disease, but you develop epilepsy, especially some of us who are adults. You can develop epilepsy from nowhere. That is what we call idiopathic epilepsy. And you see how stigmatized you become, because somebody will ask, it may be it's witchcraft, it may be a bad omen that you have gotten it. So some of those things need to be demystified even to the communities where we come from, that to understand that this is like the diabetes, it's like the TB, it's like the blood pressure. Because for blood pressure, for you to live a normal life, you have to take medicine throughout. For you to live a normal life in diabetes, you have to continue taking either the medication, either the injection, and live a normal life. The same way with epilepsy, you need to take medication. And then the other thing, you need to take precautions. As much as the way we do it in diabetic patients, that they have to know their sugars, they have to know what the sugars are done or when they are. For the epilepsy people, they are emotionally stressed. So when they're emotionally stressed, they may get a conversion. When they have excitement, they have when they get some infection, that kind of thing. So
All right, we'll get back to Joanne so that she can expound some more on that. But speaking of health and safety, I think these two are huge concerns for that matter. Probably what it is that she has mentioned in regards of, walk around with a label. It doesn't make you less of a human being, helps you even further in the event of any danger. But then my question then would be, wouldn't that escalate the levels of stigma? But then what is left of, the society in terms of, them being enlightened of this and, being given lessons that will be helpful in terms of, addressing or making them shift their view of this scenario, even as we expound some more on some of the health concerns that one would want to take note of.
I think we wouldn't advocate much in trying to say label. Although that comes with an advantage on the side. But I think what Joanne is also trying to say is there is still a huge gap of people understanding what epilepsy is, what epilepsy is not, and the fear. We still have people who think that if they find somebody having a seizure and they touch them, then that can be transferred to them, you see. And you still find people who think that if somebody falls and they have a seizure, how do we ascertain that they are not pretending or they are sick and the like. So I think it's the gap here of awareness that we are trying to address. There's a lot that is being done. I sit at the National Epilepsy Coordination Committee board as the board secretary, and we've been having for the last 5 years a campaign called Angaza Kifafa. So it goes down to the counties. So far we've done about 18 counties, and it has 3 components. There is a gap of treatment, and this gap of treatment also has been contributed by the few specialists that we have in the country. At the moment we have 2 epileptologists, and I know one who is practicing and the other is on the research bit of it. And so one of the components for the Angaza Kifafa is to train the medical practitioners so that at the end of the day they have the basic knowledge of being able to do the proper diagnosis and give a lead to the medication that is supposed to happen. Then the other one is training the community health volunteers, because they play a very key role. They are attached to households and they can be able to point out and say there is a child who is locked up because they have epilepsy, or there is a person who is not living a full life because they have epilepsy. So they help so much in spreading the word. And then now we have the public roadshow caravan where you reach out to people with information. So I would say a lot is happening right now in being able to really bring people to the picture of what epilepsy is, so that we will not then need not to label people who have epilepsy, so that we kind of like identify them from the rest of the people.
All right, so when a couple of questions coming in, how do I find an epilepsy specialist? Probably Joanne would be able to answer that. And even as you answer this, lots of concerns are here, and there's one who's asking, are there special concerns for women who have epilepsy?
Yes.
Joanne?
Can I start with one? Yeah, can I start with the saying that for those who want to are specialists in Kenyatta, we have a neurologist, doctors, and we have clinics, and also we have also for pediatrics, for children, we have them in KNH. And for the others who can go to the privates, we have Naga Khan, we have Professor Samia, we have Dr. Miyanji, and also in Nairobi Hospital, we have Dr. Mativo, we have and also we have Professor Maya and many others. They cannot be mentioned. So for the women, yes, we manage women differently, and especially for the childbearing women. There are some drugs that you do not take when they are pregnant. So when a woman is preparing to get pregnant, he should tell the doctor, because we have to pray about the drugs. because their medicine, some of them, they may bring children, with the malformation, what I would call malformation or neural defects. The other thing is that every woman who is having epilepsy should always be on folic acid to help in the building of the body, and also to help even in the blood building, and also the nerves and the neurons that you even for a woman.
All right, that's our.
Yes, so every woman should be on folic acid. And if a woman should get pregnant, should tell the doctor so that you can know how to pray about the medicine that she is taking. Because there are some medicines that are not allowed to be taken by women, especially when they are childbearing. And that is like April.
Well, all right, I don't know how comfortable Frederick is to speak of his baby sister, and I know baby sister is a woman, and sitting at that national beat of matters epilepsy, I'm sure you also have had a chance to interact with them that are male, and you'd probably have noticed any differences, or the way we deal with this is more or less the same.
Because I've been a caregiver of my sister for all this, and she's now 15 years old, and I have seen the transition, and so for her being a girl to getting to a teenage and experiencing the changes that she has had to go through, of course the changes have also equally come with a change of medication to just keep her going. Right now she's about she's been 5 years seizure free. Ooh, but it's because, again, we started medication a little bit at an early stage. What we need to note is for a patient who is female and at that point of growing up, the challenges that they are bound to either go through is as a girl, as they develop, and then when they get to that position where they have to experience their menses, you need to be very careful, because there are things we call the seizure triggers. So they could be on medication, but at the end of the day, they still get seizures, and this can be contributed through the triggers. So triggers for the girls or for the boys can be different, and they don't only come through their body physique changes, but others are also contributed by lifestyle, and it could be either watching the TV for long, the flashlights when they get stressed, people who take alcohol and you still have epilepsy. You see, you will be advised not to, because that will end up being triggers. So basically it's the lifestyle for any, whether female or male. It's the lifestyle of how you live your life, knowing that you have this condition that you need to be very careful about.
All right. Well, even as care is advised, then one would want to understand how best do they live a normal life without feeling less of human beings, or then how do you get to speak to them and give them these counseling sessions that would allow them to understand that in as much as they have this condition, then it's really not a reason for them not to live a normal life. I'd want to assume that maybe you say, well, in as much as you want to go to boarding school, you will not go to boarding school. In as much as you want to eat this, be able to eat this. You won't watch TV for long hours in comparison to others. What adjustments, as a family setup, are you forced to have so that at least you make her comfortably?
Well, the reality that if one person has epilepsy, indirectly, she or he ends up affecting like 5 more people in terms of even how they begin to do their things. And I will still draw that example from the family setup that I come from, and our sister being the last born and being the firstborn, and seeing how that it affected us. Because at some point I even had to quit my job to just go back home and assist mom take care of her. So in very different aspects, epilepsy has an effect not only to the way life turns out to be to the rest of the people who are not affected by the condition, but you look at issues of economy, because the medication is not cheap. We have some of the drugs that are very expensive, and so you will find yourself getting to a position where you need to forgo some of the things that you'd want to enjoy in life, so that much of assistance is given to this one person. Yeah, so that is one of it. The economic bit of it has a very big effect when it comes to, and when you look at epilepsy generally also, you have most of the cases also coming from families that have a very poor background. Poverty levels are very high for such families. So again, that becomes a concern, because if you tell them to go to the hospital where they will be told this is the medication that will help this person, then how do they end up accessing that medication? And that's the message that we are trying to push also through the government, to make actually anti-epileptic drugs affordable.
All right. You will realize that Dr. Joan is in a work environment. I don't know whether we have her yet. Duty calls can, in a way. All right. Well, what push is being incorporated at the level of governance, and so much so, to ensure that these individuals are allowed space to grow, space to work, space to be like any other, citizen, in terms of, creation of job opportunities? Or are there occurrences when, you can be locked out just because of your medical condition, Joan?
Hello, can you hear me?
Yes.
For the job opportunities, there are people who are able to do it, and especially those who are able to be controlled when they were young, if they got it when they were young, and those who got it when they are an adult, they have been continuing with their own employment, but support has been needed to them that are working. Because when such a condition happens, everybody, when they get a seizure in the workplace, people become scared. So a lot of support, what we call support in the workplace, which is really needed. The other thing that I would like to talk, as Frederick had earlier on said, that even as caregivers, leave alone the health professionals, caregivers at home who are taking care of those people living with epilepsy or people with epilepsy, they should always observe any abnormal change, even in their seizures. Because the way earlier on when I was trained in nursing school, I was trained about generalized. We are told the common one is that, but there are so many that happen that really make the people to regress. For instance, like those ones that we call absence, they may be happening to an adult, they may be happening to a children. And if somebody is not keen to observe, you never pick up, and the drugs that may need to connect you to be able to stop those abscesses may not be put into that patient. Because you find that that person, and even the children, they regress so much because of those small conversions or seizures that happen to a child or to an adult. Even for an adult who has been living with epilepsy, and you realize that he's regressing, he has been very active in whatever he has been doing, and is regressing, try to check what is really not happening. What is really happening? Sometimes you get to have strand speech. Like for me, I really advocate, especially for children or persons with neurodevelopmental disorders. What I call neurodevelopmental disorders. We call about cerebral palsy, we call about autism, we call about Down syndrome, and all those people, they also suffer, because when you have an issue in the brain, they will always end up to having seizures. Unlike the children in autism, they may not be having seizures at that particular time, or they may not be having epilepsy at that particular time. But as they grow up, as age grows, because of maybe they have been brain infarcts, maybe they have been changes in the brain, they may develop seizures. So how will you tell that parent or that mother that this child has started having epilepsy. Initially, the child didn't have epilepsy. So it is important to do a health education to the caregivers of those people living with, for those people taking care of persons living or people with epilepsies, so that they can always monitor and see. And even it's especially when you come to the clinic, because sometimes we give you a clinic of 6 months or 3 months. You need, if there is any abnormal thing that you, or it's easy to take a photo with your phone, and then you can always show us what is happening.
All right.
Have I answered your question?
Yeah, you have. Thank you so much.
Yeah.
And, expounded even some more. As we come to a close, also, there are a couple of questions that maybe you might have answered or we might have answered, but I think it's fair that we repeat for the sake of the people who are watching. And one is asking, can a person die of epilepsy? If I have epilepsy, can I still drive a car? If I have epilepsy, can I exercise and play sports and, all these other activities that involve so much of a physique?
Well, to start with the fear of death for anyone who has epilepsy, it's the if one is prone to seizures, then they are at a risk of maybe death, I would say. And it's the injuries that are also caused by one being prone to seizures, because you never know at what point or at which place person will have a seizure. You have people who have get a seizure when they are sleeping, and because they don't have an assistant there to help them, maybe they were sleeping in a position where their face was tucked into the mattress or the pillow, they suffocate and they die. Others fall in water, others fall on fire. So it's the danger of what the seizure prones somebody to. But if these seizures are controlled, then there is no need to fear that somebody will die from epilepsy. And then the other question about
driving.
You need to get a certification really from your doctor. We don't have a clear law that distinguishes people who have epilepsy to either drive or not. But you see, for the same reason of the fear of you could be driving and then you get a seizure and you can cause an accident, God forbid if you are a driver who drives either the buses or the matatu where so many the lives of other people are on your hands. So and it has been advised before that if one has been seizure free for about 2 to 3 years, then they can be considered for such. But when it comes to sporting, when it comes to exercising, it's something that we encourage, because again, it gives somebody an opportunity to know that they can live a normal life. Maybe with caution for sports like swimming, other sports that a little bit put somebody into a danger just in case they get a seizure and they are alone, then that can actually be looked at with a lot of caution.
Okay, well, thank you so much, Frederick. As we come to a close, 30 seconds, Joanne, as we commemorate this day, what strides have been made? What efforts have we put? And where are we headed in terms of making it, a better environment, so to speak, for the people who are patients and even for the society at large?
The first thing, before I wind up, as we have talked about whether it can
kindly
cause
make
death,
it brief, yeah.
Is that it can cause death. What I would talk is about there is a sudden death on epilepsies that happens at night. Most of the epilepsies people die. Leave alone those ones that have fallen on the water, have been burned, or they have had an accident. There are others that die at night just because they got a conversion and they were not able to breathe and then they were choked. That is what we call sudden death in epilepsies. That is a health condition. The other thing is that we need to have first aid. People should know first aid. Many years ago, what I'm talking about is about first aid in epilepsy. Many years ago, people used to when you get a person with generalized epilepsy, you put a spoon. These days, we don't put anything on the mouth. Allow to a patient to sleep in a soft, put a soft thing in the head so that it doesn't injure the head, and allow the patient to finish what he is doing, and after that, ensure that the patient is safe, and also make sure that the air, that he is able to breathe, so you put in a semi-prone position so that he can be able to breathe in, and once he wakes up with a lot of confusion, ensure that the patient is safe, and wait until the patient is fully awake. So mine is, people should know the first aid of such a patient.
It would have been very bad for us to go without mentioning that. It would have been very extremely
First aid at home.
Yes.
First aid anywhere, even on the road. First aid, so that you can prevent more injury to that patient. Remove anything that can injure that patient in that particular position.
Thank you, Joanne.
Make sure that the head,
Thank you, Joanne, for that. Now that Joanne has chewed all this time, 20 seconds to speak of the strides we've made.
So far, as I mentioned, 18 counties covered. We're still looking forward to cover more this year, about 4, until we are done with the 47 counties, to just spread awareness across the country. And on individual levels also, we have organizations that are also doing very good work in terms of epilepsy awareness across the country. So I think it's about joining hands with the relevant authorities within the government to just give epilepsy a voice, and we will be good.
Thank you so much, Frederick Berucci, epilepsy awareness activist, and nurse from KNH, Madam Joanne Kagema. It was good having you this morning. Time is extremely not on our side, but I'm glad that we've spoken about this. Remember, it's all about awareness, and that mention that we've talked about, I mean, that session that we've had is good enough to give you that awareness and enlightenment on this. And on that note, it's about time that I call it a day, but not before I remind you of the goodies that we have for the Valentine's weekend. So hold it right there, hashtag TV47 Valentine. You go there, get to understand the goodies that we have in store for you. And this will be courtesy of Morning Cafe, Valentine's Cake House is on board, Mizizi Africa Homes is on board, the Emory Hotel is on board, the UPI is also on board, and all these people or all these entities will be giving you goodies for your loved one and for yourself on the Valentine's Day. So hit that page or hit that hashtag and get the details of the same. We'll be giving you updates of all this the entire week up until Friday, when we'll have that special edition of a show. So keep it right here. It's always good to have you. It's because we love you, and so we're going to share and spread that love. Thank you so much. My name is Linda Alela. Once again, it was good having you from the word go up until now. I see you again tomorrow. Thank you, Frederick. Thank you so much, Joanne.